Okay, good evening. So this evening, or this good morning. Our lesson for today is about clinical electrical stimulation. So sort of summary, at the same time, additional lesson for electrotherapy. So after this, we're going to discuss TENS. Then after that, interferential current and using iontophoresis. So we will discuss those things. So to start, we'll discuss the application and techniques. So we have already discussed much about the concept. So today we're going to discuss the techniques on how to apply, how to operate your modalities, especially your electrical stimulator, may it be functional or neuromuscular electrical stimulator. Control of electrical stimulation. We're going to talk about the dials and buttons, which is found in your modality. Now, a common misconception is that because batteries provide the current, and usually it is used by your modalities, most of them are battery powered, especially if you are assigned in areas where there's no outlet for your adapter. But even if you use adapter, still the power that is being released by that adapter is in DC form or direct current. Okay. So we thought that it is already DC, but no. Once it enters your device, in your device there are a lot of hardware, transistors, integrated circuits, which convert your direct current into maybe alternating, or maybe enhances it to become a smooth. You know. Okay. So this is for the most part inaccurate. The exception being devices, being device exception being devices used for IOTA process. So usually IFC, no, it is an AC, siya DC. Okay. Now, although DC is provided by a battery, electrotherapeutic devices may provide a variety of other waveforms, none or only one of which may be DC. So, the gansa klase, though, there are a lot of waveforms. So, it could be a biphasic, monophasic, Russian, surge, or rump. So, depending. No? So likewise, line power devices receiving alternating current from the wall outlet do not deliver true 60 Hz AC to the patient. So again, even if you put it in the socket, it's not necessarily mean that the output of that device is in alternating current. It would be in DC form because it might be converted, no, inside the device. So rather the alteration of battery provided DC and household AC to another therapeutic waveforms occur through the use of, again, so these are the parts that is found inside your device: rectifiers, transformers, filters, and regulators. So also all of these parts are found inside your device. So the controls are often labeled. No? So usually if your pulse duration and frequency are found there. So the pulse duration may often be labeled as pulse width. Okay. Then the pulse frequency is often labeled as rate in pulses per second or frequency. So you could see that in your device. So you can select the number of pulses per second or pulsatile current. So you can see that now later in the image that I'm going to flash. You can see that example. So to understand what the device can be used for, simply look at what parameters the dials and buttons control. So you just observe the read. That's why it's very important to read your manual before you are going to operate. because the manual indicates how are you going to operate your machine. It is there. At the same time, how are you going to troubleshoot your machine or your modalities if there's a problem that will happen. So here, if a device has controls for on time and off time as well as ramp up and ramp down, it is probably designed to activate skeletal muscles for strengthening or functional activity. If a device offers control of frequency and pulse duration but lacks on-off time, so it's probably used for electroanalgesia and not for strengthening. So since the current is continuous, so it is more on tense, no, for pain relief. So we have here a sample of the machine. So we have here time in second contraction. So you notice we have here the contraction and relaxation time. So means when you say contract, that is the on time, while your relaxation, that is your off time. So you have here the frequency, you have the ramp. So it means to say this is used for stimulating the muscle. No? You have here the pulse width, the pulse rate, frequency, and pulse width. So there's no other control. So it means to say it is a 10. So it might be also an IVC, so non-ISO. So these are only samples. So it's very important for you to look at the controls of your modalities and analyze it if it is for stimulation or for analgesia, for pain relief or pain control. So at the same time, you can try to test it on yourself. Don't just like operate your machine or your modalities and apply it to your patient without trying it first. Because how would you give an instruction to your patient to know if it is really functional or not if you don't have any experience with your modalities? So now, due to improvement of technology, there are a lot of changes that happens in our electronic or electrotherapeutic devices. The first, the transition from analog controls to digital controls. So because of this, no, often, and I say digital controls, there in digital controls, you could easily read now the parameters. No? You can set now your parameters and you can easily monitor that. The numbers indicate there what is the parameters of the modalities that you're or the parameters that you use with regards to frequency, with regards to the pulse width, the on and off time. No, it is already there indicated. So although the progression from analog to digital control may seems like technological progression, still there are limitations to the use of digitally controlled parameters. The second is noticeable changes is the pre-programmed clinical treatment protocols, wherein you have there already pre-programmed. So you only have to do is to press the button and automatically the output will be already set. The parameters are already there. It's already set now. All you have to do now is to increase the intensity or decrease it. However, why are this happening? Why there's a change of analog controls to digital control? One of the main reason is because of there's a decrease of clinical competency in using this manual control. No? So the problem doesn't is in the one who operate the device or the modality. There's a decline of clinical competency. So I mean, what does it mean? So it means that the one operating it either don't know what parameters, what is going to use with the case. No, he doesn't know how to apply the device on the patient. Maybe because he lacks the skill in assessment, or he lacks the knowledge uh, in with regards to the case that he is handling. No? So that's why there's a poor clinical decision making. No? And at the same time, poor clinical competency in how to differentiate between the using the ES or the TENS for the patient, or for is going to use this modality for to treat, to re-educate, or to stimulate the muscle, or to address pain. No? So, nana. So there are a lot. There are, when you talk of ES, there is an important parts of ES which is we need to consider. The first one is the electrodes. Now there are a lot of types of electrodes at the same time choices. So electrode is defined as the device that serves as an interface relaying current between an electrical stimulation device and the patient. So it is the one transferring the current, or introduce the current to the patient. No? It is your electrode. Now there are two classes of electrodes. One, surface or transcontinuous electrode. So, so can be seen. Second is your invasive or indwelling electrodes. So there are some electrodes that is used, being implanted to your skin. So example of that is the adstuck electrical stimulator, which is used for stroke patient, which is implanted in the, usually it is used in the ankle dorsiflexor, kay adstuck naman siya. Okay, so it is used to dorsiflex your tibial, your foot, no? Especially during gait. So ang ginagamit nila is yan, indwelling electrodes. So electrodes varies in many ways, such as in shape, dimension, flexibility, method of adherence to skin, and cost, at the same time material. So metal electrodes are usually made of thin steel, aluminum, which requires a wet sponge as an interface between the metal and the tissue. Now, because it is a metal, so there is a high risk of burns, but it is a good conductor, so it can easily transmit or introduce current to the body because it is a good conductor. So we have also flexible electrode. So flexible electrode is usually made of carbonized silicon rubber, having the advantage of pliability while maintaining good conductivity. Flexible electrodes may be designed for long-term repeated use, short-term use, several days to weeks, or one-time use. So these are example of flexible electrodes. So most of the flexible electrode that is used for long time is made up of rubber. No? Then one-time use, so na siya kani siya, no? Medyo may cloth siya, then na siya adhesive. Here in the rubber, you need a coupling medium, so usually gel. No? Then we have here metallic, so these are example of metallic electrodes that is used for implant. No? So kanina yung needle, say pins. No? So ina na siya. So kung naka-implant, so kani siya mo i-attach. Okay. So disposable electrodes come in many different sizes and shapes, including those designed for small sites such as fingers to much larger sites such as the lumbosacral region, One disadvantage of disposable electrode is that they need to be replaced often, yet the number of times that reusable electrode can be safely and effectively used varies greatly. So, disposable electrodes, daghang size and shape. So, naa siya adhesive, no? So, sometimes, ang isa niya ka-disadvantage is there are some individual who is allergy to the adhesive, no? Kani example ani kani this one. So allergy siya, no namula. Siya hyperemia. So hyperemia is an indication of first degree burn, no, di ba? So na siya burn. So maybe kung padugayan pa, it could be resolved to blister. So inana. So although it is an allergy good siya, pero plus pa the electricity. So as we all know, when you are allergic, uh, there's what happens, there's an inflammation sa skin, no? So ang iyahang permeability will become uh, more permeability in tissue, so sulod ang current, so dali siya mapasok. So, nana na siya ang iyahang kwan. So bantayanan, no? So okay ra kung ang imong patient, ang iyang complaint lang is na siya pruritus or itchiness, mga ato lang siya. So if you have this kind of reaction, so that is a different story. So you have to stop using this kind of electrode. So you use the rubber one, then put gel on it. Then of course instead of using, uh, you should use tape, no, para maka-hold. So applying electrodes. Now before applying electrodes, you must clean the skin, no, and evaluate also. So to ensure optimal conductance, when you say conductance is to make sure that your skin can conduct electricity. So thorough cleansing of the skin with soap and water. So sabonhan, hugasan siya din ng tubig. So para matanggal, mo remove ang oils, dirt, lotions, which can act as resistance to the current. So do not use alcohol because alcohol will result to dryness of the skin, and when the skin is dry, it offers resistance. So if you're using sponge, make sure that the sponge of your electrode is wet. So use tap water instead of using distilled water, because distilled, as I've said before, it cannot conduct electricity because it is pure water. It lacks an ions, no, especially metallic ions that could serve as conductor. So if you don't have a tap water, you use saline solution. Okay, how to make a saline solution? It's very easy. If you have a distilled water, just add salt to it, then voila, you have now a saline solution. So the choice of electrode size should be made with two things in mind. So kung magpili na ka sa kadakuon sa imong electrode, so na duha ka butang imong hunaon-hunaon. The goal of the treatment and the size of the area to be stimulated. So what is your goal? If it is your goal is to stimulate a larger group of muscles, then you use large electrode. If you are going to stimulate small, then you need to use also small electrode. Okay, so let's take for example, there's an example here. You are going to stimulate the quadriceps. So you must be using a large uh, electrode. If you're stimulating the gluteal muscle, so the gluteus maximus, so you use the large electrode. So remember also that the electrode size and the amount of current density uh, is inversely proportional. So when you say inversely proportional, that the smaller the the electrode, the thicker the current density. Baga ang current density ana sabot kusog siya kay baga god, no. But the larger the electrode, the current density becomes thin and it is dispersed. No, dili siya focus. Na. So how to place an electrode? So this is one, no? So you have to detect the motor point. So although na isa sa technique katong gitudlo ko ninyo where you are going to look for the muscle belly because the muscle belly is it is where the usual area where the motor point is found. But you could use this technique, the moving or gliding. Okay, so this technique, first you're going to put gel on the electrode, no? Especially if you're going to use the reusable katong rubber. And then you're going to slide, no? You just put it in the area where you want to stimulate the muscle. Then you have to slide it down. So you move, you on your modality. Then until the muscle contracts, then you have to slide it down slowly. And you have to observe in which point where there is a greatest muscle response. So when you can see that, so that point where your electrode is placed, no, kung duha ka electrode ang butang, ang isa na naagid siya sa motor point. So basically, kung asa to dapit ang bili, that's the motor point. Okay, so then you put adhesive or you put tape on it, no? So, when placing electrode for motor stimulation, a very common mistake occurs when one electrode is placed over a motor point and the other one over a motor distal site. So, muna siya common mistake. So, of course, if it is on distal, what will happen? Uh, na siya ay disperse, no? So, dapat ko no, dili lang gid kaayo siya palayo. Okay, so if you want to stimulate the muscle. So, the problem is, this is the problem number one, the distal electrode is often placed away from the region of motor nerve where the optimal response is obtained, rendering the stimulus less effective. So kung palayo gina siya, may mo siyang less effective. So the distal electrode is often placed in a region where there is no significantly less or no depolarizable muscle tissue. So dapat ang imuhang ang electrode nimo ibutang nimo siya kung naasa ang naay muscle pa nga pwede nga i-depolarize. So instead of putting it here, which in this area, this is more tendinous in the extensor group, it's better to put it somewhere here. So dorsum ani, kay there are small muscles there. But kung dili ni kwan, dire na lang siya ito paduol mo. No? So ina na siya. Just like this one, which is more. Okay. So electrodes should not be close together. Di siya kaiduol kay because that they may come in contact with each other. Then because of the current density, no, daghan siya. This may result to increased current density and sometimes it could result to burn. No? With wider spacing, a greater current amplitude can often be used to reach the deeper tissues. So kung lagi on sa nimo, mas dalom. So let's take for example, if you're going to stimulate quadriceps, uh, and if you notice that your patient have strong um, hip flexor but weak ang knee extensor. So, which means to say that the problem is on the single jointed quadriceps muscles because in the rectus femoris, pwede siya nga tabangan siya dito no na maka-flex mo siya sa hip niya. Kung ang main problem nimo dato si mo hang pure sa ni knee extensors which in which ang imong vastus muscle may knee extensor. So how to stimulate your vastus muscle? So you place it, no? Place it dito sa imong quadriceps. So since naa siya sa deep ilalong, especially ang intermedius, okay, mo man na siya gadalagid sa strength nimo sa knee extensor. Kay dako man na siya. So how you place how will you place the electrode? So, ipalagyo nimo ang kuan. So, from the bili, from the motor point area, then ipalagyo nimo siya. Butahan nimo distance. Diba? So, inana no, para ma-stimulate ang intermediates. Kaya again, kay kung lagyo, mo deep ang travel sa imuhang current, then ma-stimulate ang deeper muscles. No? So, wider spacing can also lead to more motor units being activated. Aside from it reaches the deeper muscle or deeper tissue, it can stimulate more motor units. Then, of course, that would be necessary. No? Electrode configurations. Now, the majority of electrotherapy techniques consist of single circuit, two electrodes placed over the target tissue. So this is a single circuit. Pero ang pinaka-common is the bipolar electrode configuration in which all electrodes of a single circuit are placed over the treatment area. So the bipolar configuration is most commonly used in biphasic pulse current, burst modulated Russian and pre-modulated currents during stimulation of muscles. So using NMES or FES. So, so biphasic man siya, so it is alternating current. So, di ba? So, bipolar na siya. So, when you say bipolar, a muscle, uh, stimulate na siya, ang imong electrode are placed on the same area. That is what we call bipolar technique. Okay, so the electrodes are usually the same size, so the current density through each electrode is equal. If the two electrodes differ in size, the smaller of the two will necessarily have a greater current density and impedance than the larger electrodes. So all the electrodes are considered treatment or active electrodes with bipolar electrode orientation. So since AC man nagigamit nimo, so expect ka nga ang duha ka electrode is uh, active. So wala na siya na walay kalainan, no? Uh, kuha na siya kanang sino? Walay positive or negative ana kay biphasic man. So it's either one of them is active kay alternating man and ang isa mo siyang dispersive. So after mo change na pud ang wave niya, ang isa na pud ang mo active, then ang isa na pud ang mo dispersive. So nana kay alternating man puli-puli. So dili ka ka-determine which is the positive, which is the negative. Unless dito ka sa tens. No? So this is an example of uh, uh, the electrode configuration. So this is the monopolar. So monopolar, when you are going to stimulate, so kani dra siya butang sa likod, then ang isa ka electrode nimo is wala siya sa region. So this is usually used in treating wounds. No, inana siya. So mga healing, mo na siya ginagamit. So mas lalo man ang penetration ano. So, you have here the dispersive. This is na your uh, feed na electrode. So, kasabot kani siya diri katag no pag-release niya sa current ya diri is very condense siya no focus niya. So probably diri ang wound depit no. So, nana. Then this is the bipolar. So the same region ra gyud sila. Then this is your quadripolar. So usually quadripolar electrode is used in iontophoresis and interferential current. Ano in description? Monopolar, active electrode of single circuit over target area, inactive over nearby non-treatment area. So, kani non-treatment, kani sa treatment area nimo. So, it is used for brain modulation, iontophoresis, and tissue healing. Ang bipolar, both electrodes have a single circuit over target tissues. So this is used for muscle activation and pain modulation also. Quadripolar, tanawa na to, pain modulation lagi siya. No. Single circuit may position over. Yeah, so that is monopolar. So monopolar electrode placement is most commonly used with DC and monophasic pulse currents during iriantophoresis and many application for wound or tissue healing. So, inana siya. So, ginagamit siya sa iriantophoresis and sa tissue healing. No? So, sa mm, mga pressure sore, mga big sore, mga sa na siya, mga sa fracture, no? So, inana siya. So, monopolar ang ginagamit siya. A third electrode configuration exists which involves the application of two or more electrodes from two separate circuits. The electrodes are placed so that the current are intentionally crossed and prepared as interferential current. So, inani siya sa quadripolar. So, common na siya sa, as I mentioned a while ago, sa iontophoresis and sa imuhang IFC. So, electrotherapy application and techniques. Why use electrotherapy? Ano magamit kag electrotherapy? So, clinical application of ES are most commonly used for the following purposes. Number one, to activate skeletal muscles for improving muscle performance or strengthening. So, para makamata siya. So, makamata, di ma-strengthen siya. Kaya nga magka 1, grade 1, grade 2 na siya. At to attenuate or alleviate pain. So, to improve blood flow. So, of course, when the muscle starts to contract, blood circulation increases to decrease or control edema. So, kung mag-circulate na, so kung na ay edematos dito, kaya nag-contract naman siya, the pumping effect of the muscle contraction will result to milking of the edema or the fluid that is in your soft tissue, no? Para mabalik siya sa lymphatic circulation or sa venous circulation. Then number 5, to facilitate tissue healing. So activation of skeletal muscles for strengthening is referred to as neuromuscular electrical stimulation. So gikan na siya. So ang term dito gamit sa don't take me wrong, strengthening. Yan naman ang goal mo dira is to waken up the muscle at the same time to increase the strength from 1 to 2. Once there is already partial range of motion, you use now your FES. Okay. Activation of skeletal muscles for re-education or movement training for functional use is referred to as functional electrical stimulation. So, inana na siya. No? Kung ano siya grade 3, so, dito na ka sa FES. No? Functional movement nang ipaperform niya together with your FES. So, ES for modulation of pain called transcutaneous electrical nerve stimulation. Despite nearly all forms of clinical electrotherapy being transcutaneous. So, this constant ni siya. Saragid na siya, no? One direction ang pag-fire niya. So, sige. So, monophasic. Ang tense nimo is monophasic. So, isa lang ay iyang direction. It could be modulate a pulse or it could be interrupted. Basta kay monophasic lang na siya. So, basically for pain, no? So, use of ES to skeletal muscles below the threshold of muscle contraction is known as therapeutic or threshold electrical stimulation. So, muna siya isa ka kwan. So, kung ang imong kwan is, igo lang siya ma-feel sa patient nimo. So, that means to say, below the threshold of muscle contraction, but perceptible siya sa imong patient, yan na siya ma-feeling electrical current, pero there's no sign of contraction, or like twitching. We call that as threshold for threshold electrical stimulation. So, hindi siya nimo gipukaw, no? Gipukaw siya nimo. Walay twitch. So, ang ginagamit sa scoliosis is a different thing. No? Periodic electrical stimulation is not common as it once was. Nevertheless, it is represents another use of acronym to describe type of application or use. So before the advent of short Barcelona technique and in treating the scoliosis, before ginagamitan nila og ES, scoliotic electrical stimulation. Asa man na ibutang dito sa imuhang paravertebral muscles. So kung asa tong na-stretch, mo to sila stimulate, no? Inana para mo-contract. Kay ang concept ana nila class is ang ahatong convexity kana nga muscles is nainat. So ang iyang contraction is weak or wala siya contraction, no? So para ma-contract siya, applyan sa electrical stimulation para mabawi. Ang imong concave nga side sa imong scolio dili siya butang ang ES kay ang concept ang muscles dira is nag pangusog, no? Nag-spasm siya. So kung imo pud dili siya butangan og ES, na tendency nga di siya mo relax, no? So dapat ka ni-stretch na siyang concave nga side. So mo na siyang concept, no? Sa una, pero because of the advent of modern technique in treating the scolio, nawala na siyang ES. But of course, there are some other doctors that still uses this kind of technique in treating scoliosis. No? Na physiatrist yapon mo order og ES para sa scolio instead of prescribing only exercises. So, electrotherapy for activation of skeletal muscle strengthening and to education. So, in it has generally come to imply use of ES for purposes of increasing strength in innervated muscle, whereas electrical muscle stimulation implies stimulation of the innervated muscles. So, So, in MES, ginagamit lang na siya kung innervated. So, when you say innervated, what kasabot, intact ang imuhang peripheral nervous system. No? Ang problema nimo is na dito sa taas, sa central. Okay? So, siya. Denervated means severed ang imuhang PNS or peripheral nervous system. So, it could be na kay neurofractia, axonotmesis, or whatever that damages your PNS or peripheral nervous system, especially the motor part. Okay? So, you use your EMS or electrical muscle stimulation. So, the fundamental difference between MES and EMS is the tissue that actually stimulate and depolarize to elicit therapeutic effect. In MES, innervated muscles intact ang peripheral nerve which has a lower threshold of depolarization. So if you notice sa mga stroke patient, uh, dali ragid ka siya ma-stimulate, no? But with the peripheral nerve injury, lisod, no? Kay dili man intact ang iyahang uh, peripheral nerve. ES in the nervated muscles does not depolarize the peripheral nerve, but rather the muscle itself. That's the name electrical muscle stimulation. So, ana siya, no? So, sa denervated muscle, dili iya gina-stimulate ang peripheral nerve. Kaya naman, severe naman to, so dili niya ma-stimulate. So, unsa man iya gina-stimulate? Direkta niya gina-stimulate ang muscles, no? Bypassing now your myoneural or neuromuscular junction. So, functional electrical stimulation has come to describe ES of innervated or denervated skeletal muscle for the purpose of facilitating or enhancing functional movement to assist dorsiflexion of ankle rest extension and paretic anterior tibial muscle or wrist extensor respectively. So kani siya, ang FES, ginagamit niya siya para ma-stimulate tong denervated or innervated to do functional movement. Let's take for example na stroke ka, no? Dili nakakagunit sa baso. So butangan na siya og ES para makagunit ka. So, just like atong video nga gi-show nako, no? So stroke man to siya, so innervated to. But if you have PNI, pananglitan na severe ang imong radial nerve, no? Kay nagka-fracture ka sa supracondylar ridge. So therefore you have wrist drop. So wala kay wrist extensor. So sa nimo pag-grip sa baso, di ka ka-grip sa baso. Try ninyo nga wala kay extension, naka-wrist drop ka niya, i-grip ang baso. Pwede ba? Dili, no? Weak siya. So, dira, butangan dayon siya og functional. Sa man, ipa-extend ang wrist para ma-increase ang tenodesis reaction sa flexor group o muscles para mas kusgan ang gripping sa baso. Okay, so inana na siya. No? So, here, strengthening, makita na to NMES. Again, to emphasize anang word nga strengthening, that is only for para na siya mo grade 1 or mo grade 2 ang imuhang muscle. So, di ba? Ana, apply nga ni mo NMES kung zero pa siya. So, muna siya yung mga waveform, then the parameters, na siya dira, pulse frequency, pulse duration, for contraction, for functional use, naapod ang iya dirang parameters. So, makita ni mo yung duration, task specific. When you say task specific means kung say task nga ipa-perform ni mo niya. So, depende siya unsa ka dugay, no? Pag gunit sa baso, inom, pila man na siya ka seconds kaya nakainom siya nga nag-hold siya sa glass. So, inana siya kadugayon ang pag-stimulate kay anya pag gunit niya sa baso matanggal di useless ra gyapon di siya kainom kaya igo raman siya nagunit pag human di na niya malift kay mabuhian naman pud niya diyon so dapat kung unsa kadugay ang pag-perform sa pag-drink niya sa tubig upod ang kadugay nga nag-hold siya datong glass so mo nang ginatawag siya nga task specific so dito sa taas na siya 10 to 20 contraction so dito sa imong NMES kay nga naman ang contraction man dito ang ginaihap. They usually kanang 10 to 20 contraction sa mga smaller muscles. No? But sa bigger, so instead of counting the contraction, libutan na nila sa number of minutes. No? So around 20 minutes. Basta mga dagkong muscles. So muscles of the forearm, biceps, triceps, quadriceps, gastro, tibialis anterior. So usually, sa mga gagmay nga muscle, that's the time you will count the number of contraction. So sa diri, at least kuno na siya uh, third, ano, 60 contraction ang kada muscle. So, and at least 10 contraction per muscle group no sa mga gagmay sa let's take for example intrinsic group o muscle sa hand so tag 10 siya 10 sa abductors 10 sa lumbricals 10 sa interossei so isa na siya ka swift no when you say isa ka swift isa ka agi 10 then ibalik na po nimo another 10 so until nga magka 60 ka so pila man siya kabalik bali 6 no tag 10 10 so ihapon nimo 1 2 3 4 one set sunod na po 1 2 3 4 one set na ni siya nga muscle kani 1 set ibalik na sad na nimo you return again no? So inana siya pag counting so sa face sa mga Bell's palsy mo na siya no? So you go with the different branches of the nerve starting from your temporal then your there is orbital a frontal then your zygomatic branch nga nasaplayan sa facial nerve maxillary then sa imong mandibular nga branch so i-count na siya tag 10 10 then balik na ka sa taas then down another 10 hantod makaabot ka og 60 so 6 no? So of course contraction naman so per contraction so is inig isa ka twitch nimo one contraction na siya no? So ana na siya count So strengthening, you use neuromuscular electrical stimulation, ES for strengthening in healthy non-weak subjects has shown that number one, use of electrical stimulation for strengthening yields better results than no exercise at all. So kung dili ka ka-exercise and patient din mo, kung dili siya ka lihok iya ha, so pwedeng ES pero much better kuno nga butahan gyud nimo exercise, no? So number two, there is no difference between strength gains resulting from voluntary exercise or the use of electrical stimulation alone, assuming the training intensity is similar. So, ang iyang pasabutan ni, it means that there's no difference between the results sa imuhang in MES and sa imong exercise kung ang intensity wala. Let's take for example. Okay. Igo nimo siya stimulate, no? Na siya contraction, twitching. Okay, using ES. Then, pag abot sa imo na nga part, igo ra po nimo siya ipapassive. So, ang intensity sa imong ES o imong exercise is maumao naman. Kay passive range of motion. Wa man ka dito other nang gihimo niya. So, may pa mag-iis na lang ka. Kaya nga naman, there's no difference man within the effect, no? So, there appears to be no benefit to the use of ES combined with exercise versus using it separately. Ah, so kung imo siyang ikuyog pag yun, pananglitan nag-ES ka in MES, then pag human imo siyang di-passive exercise. Walay difference. Diba? So unless imo siyang ipa utangan na gyud og iyang effort gyud mismo. No? So, ina. So bipolar electrode configuration is used with most applications of NMES. So sa NMES, bipolar na gyud siya ginagamit kasi used for innervated man. For education and retraining, we use the functional electrical stimulation. So take note of the word re-education and retraining. When you say re-education means you are now educating the muscle to perform the task. Kung unsa tong task niya dito sa movement that you are going to train it again. Okay, so E is used to facilitate and improve purposeful movement, assist with ablation, reverse cardiopulmonary cushioning, attenuate bone demoralization following spinal cord injury. Here, ano siya purposeful movement. So, ano siya stress nga ma-apply sa buhok. That's why na siya uh, attenuate siya sa bone demineralization. Okay, ano naman siya contraction din nga purposeful na mangusog naman siya iyahan, no? Kaya may embodiment. So, anana siya. So, for functional purposeful activity, if ES is used for this application of ES, it is differentiated from NMES is that the primary goal is not to increase strength. No? So, ang goal ni mo diri, dili na siya to increase strength but rather to perform the task. Okay. So that's for NMES and the majority of application for FES. ES works via an intact peripheral nervous system supplying the muscles to be activated. So, importante na siya, no? Kung magamit ka ani for re-education, retraining, and strengthening, importante nga intact ang imuhang peripheral nervous system. In the case of denervation, where the peripheral nerve can no longer be depolarized, thus activation of the muscle requires depolarization, so it needs a very strong current with greater amplitude ang kinahanglan gid niya and greater intensity. So it must be abrupt, no, to avoid uh, to avoid for the muscle to avoid adaptation of the muscles with this to this current. So dapat abrupt siya pag increase sa intensity niya. So inana siya. That is for denervated. And usually sa denervated ang ginagamit dili easy but rather direct current, no? Inana siya. Direct current siya nga pulse, no? Interrupted direct current. So man siya ginagamit sa mga denervated muscles. So in fact, ang other classification nila is galvanic, but na problema na if you use the word galvanic, no? Because galvanic can be used also in alternating current in other countries. Mga ito na ilang term. So, ang mas safe na term na gamiton is pulse interrupted direct current rather than using the word galvanic. Okay, so class. No? So thank you for viewing this lecture and also for bearing with the our discussion regarding electrical stimulation. So I hope as of now, na may good idea on how to use your electrical stimulation or electrical stimulator, especially if you're going to apply it to your patient. Uh, then mo siya a way correct idea on what parameters or what technique, methods, electrode science ang inyong gamiton sa inyong patient. So the next lecture that I'm going to be uploaded will be talking about TENS, no? Or transcutaneous electrical nerve stimulation, which is used for pain modulation. Then after that, I'm going to discuss interferential current. Okay, so, or interferential therapy rather. Then add on to that is the iontophoresis. Okay, thank you and have a nice day.